Imagine this, 90% of adults will develop hypertension at some point in their lives, a condition responsible for up to 50% of all heart attacks and strokes. Dr. Lawrence Apple from Johns Hopkins University calls it a ticking time bomb within our arteries. Picture your blood vessels as delicate pipes. When pressure rises unchecked, these pipes weaken over time, leading to catastrophic failures. But here's the good news: hypertension is preventable and manageable without medication in many cases. In this video, we'll explore scientifically backed strategies to naturally lower your blood pressure. These methods are not guesses, but grounded in evidence from top research institutions worldwide. By the end of this video, you'll have a clear roadmap to take control of your health. Are you ready to protect your heart and live longer? Let's dive in. To understand hypertension, first grasp how blood flows through your body. Blood must push against vessel walls continuously to move forward, much like water flowing through a pipe. When the heart contracts, blood pressure spikes to its peak, known as systolic pressure. Between beats, when the heart relaxes, pressure drops to its lowest, called diastolic pressure. The fluctuations are normal, but chronic high pressure wreaks havoc on your circulatory system. According to Dr. Paul Welton, former president of the American Heart Association, every increase in blood pressure above optimal levels significantly raises cardiovascular risk. Now, let's uncover the top strategies to combat this silent threat. First up, diet. What you eat plays a crucial role in regulating your blood pressure. A groundbreaking study published in the New England Journal of Medicine highlighted the DASH diet, which emphasizes whole foods, lean proteins, and reduced salt intake. Think of it as giving your body premium fuel instead of cheap gas. By adopting this diet, participants saw an impressive drop of 5 to 6 points in their blood pressure readings. DASH stands for Dietary Approaches to Stop Hypertension. We dive into more details on DASH diet in other video. Sodium is one of the primary culprits behind elevated blood pressure. While debates about its role persist, the science is undeniable. Dr. Frank Sachs of Harvard Medical School asserts, reducing sodium intake remains one of the most effective ways to lower blood pressure. The DASH diet recommends capping sodium consumption at 2 grams per day. However, many people underestimate where their sodium comes from. Surprisingly, only 20% of daily sodium intake stems from added salt during cooking or at the table. The remaining 80% hides in processed foods and restaurant meals. Consider this example. A seemingly healthy Mediterranean bowl from a popular chain contains more sodium than you should consume in an entire day. Finland offers a compelling case study. In the 1970s, the country implemented laws mandating warning labels on high-sodium products and promoting potassium-rich alternatives. Over subsequent decades, national sodium intake dropped by 30%, reducing average systolic pressure by 10 points. Even more astonishingly, death rates from heart attacks and strokes plummeted by 80% among middle-aged adults, while life expectancy increased by several years for both men and women. While reducing sodium is vital, increasing potassium intake can be equally transformative. Potassium acts as nature's antidote to sodium's harmful effects. As explained by Dr. Alicia McDonough of the University of Southern California, potassium helps relax blood vessel walls and enhances sodium excretion through urine. Incorporating potassium-rich foods like bananas, oranges, sweet potatoes, spinach, and beans into your diet can lower blood pressure by up to 7 points. However, caution is advised. Individuals with kidney issues or those taking medications that elevate potassium levels should consult their doctors before making dietary changes. Exercise is another cornerstone of blood pressure management. Recent studies challenge traditional notions about cardio being the sole solution. A meta-analysis published in the BMJ in 2023 compared various exercise types across 270 trials. Isometric exercises, such as wall squats and planks, emerged as the most effective, lowering systolic pressure by up to 8 points. Yet, any form of physical activity, whether high-intensity interval training, low-impact aerobics, or strength training, contributes positively. Finding what works best for you is key. Weight loss complements dietary adjustments and regular exercise beautifully. For every kilogram lost, blood pressure typically decreases by 1 point. Alcohol consumption, however, complicates matters. Contrary to popular belief, alcohol doesn't relax blood vessels. Instead, it raises blood pressure, especially with more than 2 drinks daily. Smoking poses an even greater threat. Nicotine constricts blood vessels, while long-term smoking damages their inner lining, leading to stiffness and further elevating pressure. Sleep quality also impacts blood pressure profoundly. Sleeping less than 6 hours nightly increases hypertension risk significantly. Obstructive sleep apnea, where breathing intermittently stops during sleep, is a major contributor to resistant hypertension. If you feel exhausted despite adequate rest, or if your partner notices choking sounds or loud snoring, consult your doctor promptly. Stress management rounds out our list of strategies. Chronic stress influences blood pressure indirectly through unhealthy coping mechanisms like overeating or excessive drinking. Dr. Sheldon Cohen of Carnegie Mellon University notes, "The way we handle stress matters more than the stress itself. Mindfulness practices and conscious decision-making can mitigate these negative effects effectively." Interestingly, owning a pet, particularly a dog, has been linked to lower blood pressure levels. One small study even found adopting a pet had a greater impact than standard medication. So, what constitutes ideal blood pressure? The SPRINT trial addressed this question comprehensively. Researchers compared target pressures of 140 versus 120 in adults with high blood pressure and increased cardiovascular risks. Results were groundbreaking. The lower target group experienced a 25% reduction in heart attack and stroke incidence, and a 27% decrease in mortality from all causes. Though intensive treatment brought side effects, like dizziness and kidney issues, major guidelines now recommend diagnosing hypertension 130 and 80, rather than 140 and 90. Remember, sustainability trumps drastic measures. Gradual lifestyle changes yield lasting benefits. Choose one actionable step today. Commit to it, and share your choice in the comments below. Despite best efforts, some individuals may still require medication. That's perfectly fine. It's about finding what works for you. Thank you for watching. Explore other videos on this channel for more insights into living healthier. Hit like, subscribe, and tell us where you're tuning in from.